everybody, welcome back. My name is Rosemary, aka the Bedhead Phoenix, because CRPS makes bursting into flames sound fun at sometimes. So today I wanted to talk about an issue that is very, very prevalent in my life, and I'm assuming anybody who struggles with CRPS or disabilities also has this issue. Would love to hear your thoughts in the comments about this afterwards. But today I'm going to talk about dealing with difficult doctors, nurses, any sort of medical professionals that you deal with, caretakers in your home, any of it. I've had my own issues with that over the course of this now 11-year history of this disease. It doesn't get easier when you come across one of these people, but at least you can have some tools in your kit to sort of deal with them in the best way possible so they don't completely torpedo your health journey. So without further ado, here are the top 5 tips that I've come up with that I use myself to deal with difficult doctors, difficult nurses, any of those people. Number 1. This can be the hardest at times, but my motto for dealing with anybody at any time, no matter how crappy I'm feeling, is kill them with kindness. It is so hard to do when you feel like crap, but if you start already being as kind as you can be, as thankful as you can be, saying all your pleases and thank yous like your mom and dad taught you when you were a kid, it's hard for them to kind of start in a negative way. It makes it a little more difficult. Even if they're having a bad day, they tend to maybe kind of at least perk up for a little bit when they're with you because you're being thoughtful and kind and appreciative of what they're doing for you. Doesn't always work. I'm not saying it is a cover-all tip for everybody, because even being nice to people does not always make them be nice to you. I know that for a fact. I have experienced that myself. But it definitely helps, especially being just kind to everybody, even the people who aren't difficult, because word gets around. Word gets around that if you're a difficult patient, word gets around if you are not a difficult patient. So if one person has an issue with you because they're having a bad day and they say, oh my gosh, I had this patient, Rosemary, and had an issue with her, everyone else can be like, what are you talking about? She's delightful. So even when I'm in so much pain that I'm barely able to speak, I try and cough out my pleases and thank yous when they do helpful things, any of things, because everything they do in their job is incredibly helpful. Like my mom says a lot, you catch more flies with honey than vinegar. Don't even know if that's literally true, but that's just the saying. Number 2, advocate and communicate as best as you can. That is the easiest way to keep things above board and make sure there's no misunderstandings, is to make sure that you are informed about your issue, which pretty much everybody with any disability is, because they have to be, because especially with CRPS, since it's so rare, most doctors and nurses who are just meeting you don't even know what it is, have never heard of it. So if you can advocate for what you have issues with, what you need, as far as what you need from them, that is the easiest way to make people still stay professional, for lack of a better word. If you can be your own advocate, that's ideal, but I totally understand that that is not always possible. Sometimes you can be your own advocate, sometimes you're not feeling well enough and need someone to advocate for you. And that is your right as a patient. If you ever go to a hospital or an emergency room or any sort of medical facility, you have the right to have an advocate with you. Sometimes they try and separate you in the emergency room and just take the patient to the room while the loved ones stay behind and either get you registered or what have you, ask you questions. But you are allowed to have an advocate with you at all times if you can't advocate for yourself. If you're in too much pain, if you're not really conscious, or if you're on medications and so you're kind of confused, any of those things. Even during COVID, You weren't necessarily allowed to have visitors, but you were allowed to have one person in the room with you to make sure that everything that you needed to say got across. So if you are informed about what you have and what you need, a lot of the time, the professionals who don't necessarily know everything about this are going to assume that what you're saying is correct. And if they look into your medical records, they can confirm that. But if you and your advocate sound like you know your stuff, they're going to tend to want to help you get what you need because they will believe that you actually need it, because you do. So do your best. Not saying it always works every time. Again, none of these tips are complete solves for everybody, but it's a good way to start. Number 3 is especially important if you're going in for doctor's visits, checking in at the hospital for a procedure or something like that, would be to, especially if you're meeting a new doctor, would be to look how you feel. If you feel like crap, as much as you want to make sure that you're showered and hair done and makeup if you want or any of that stuff, it's better, if they're first meeting you especially, to really see what your day-to-day life looks like. If they see you all done up like a regular person, they're not going to really understand that you struggle with this intense and incredible pain, because they're going to assume, hey, you can do all that, it can't be that bad. When in fact, you're just doing it this once in a blue moon because you're going out into the world and you don't necessarily want to look like a ragamuffin. But sometimes ragamuffin gets the message across like, oh crap, this person's not doing that great. So it's you don't want to do it. You want to go out looking like a regular person in society. But at times, not every time, but sometimes it's best to really show the world, especially the people who are going to be taking care of you, this is my life. This is my life. This is looking good for me. Like, it can get way worse. So it sucks, but sometimes it really is what you need to do to make sure that they know how you're feeling and what you're dealing with on a day-to-day basis. Number 4 is one that I would recommend anyway, even if you're not necessarily having issues with any medical professional. Seek multiple opinions about your problems, about your disease, about your pain, about whatever it is that you're communicating with your doctor about, whatever issue you may be having. It doesn't hurt ever to find another person in that same category of qualifications and just ask and see how they feel about the same thing. The more opinions you get, the better. I get that it's hard to track down medical professionals at times, but even shooting out an email saying, hey, I met with my doctor and this is what they said about my problem. Here are my medical records. What do you think? Sometimes they're too busy, but sometimes they're nice enough, at least in my case, to take a peek and say, oh, you know what? Yeah, this makes sense. And I can concur that this is what I would do if I was your doctor and you were my patient. So the more people you can have kind of in your little justice league, the better. The more opinions you can seek, the more people that you can find that say, yeah, like, you can call me or email me or whatever if you have any questions at any time, the better. That's not going to be the case for most people, so I don't want anyone to get their hopes up that they can ask doctors and nurses to do this willy-nilly and they'll all say yes. But you should ask willy-nilly anyway, and the few that will say, yes, I will be one of your contacts, is one to keep in your little book of important people. I think that's very, very important. I think it's good to find people that you can feel comfortable communicating with your issues on, and the more professionals, the better. And on that note, number 5 would be to keep track of the good eggs and the bad eggs. The people that you say, wow, he really knows what he's talking about, and they're just a really easy person to talk to. I don't have any issues with them. They don't seem uninformed or unkind. Let's make sure I remember this person. and ask them, hey, like, this has just been so wonderful. Thank you so much for everything you've done. And if there's anybody you have any issues with, it is a good idea to keep those same people in your little book that you have of people that you think are great. I think it's just as important to know who's not going to work for you as far as what you need and who is. And in kind of concurrence with that, it's a good idea to have someone in the patient or family advocacy department of any of your medical facilities kind of know about your case in case you do have issues with somebody. You can go to them and say, hey, I'm having a problem. So valuable. I know, at least in my experience, my advocate in that department has been a godsend, an absolute godsend. And they can be contacted anytime you have an issue with somebody to make sure that it's taken care of, that you don't have an issue with that person again, and that they don't really cause any issues for you. So it's good to know who you do jive with and who you don't jive with. It's also good to know who everyone in your department jives with and doesn't jive with. If you know that there's a doctor whose opinion they value very, very, very highly, talk to that guy or that girl and see if you can get them in your little team of people and get them to help you out. So if you can say, Dr. So-and-so said this about my issue, they're going to say, oh, okay, I'm going to take this a little more seriously now. That's absolutely been my experience. If you can find someone that people, admire as far as skills and qualifications, the whole shebang. And it's not hard to kind of figure out who those people are, because people talk about those people a lot, especially if you're like, they'll say maybe a nice nurse or person will say, oh, you should, talk to this doctor if you're having this issue because they're great. If they think they're great, chances are a lot of people think they're great. People don't just say that. They say that because they have experience with that. And they're in the business, so they would know best. So it is a little bit political, what isn't, but it's also a good way to really get your needs met in the easiest, fastest, most effective way possible. So there you have it. There's 5 small tips to try and navigate the broken healthcare system that we have in this country, but as broken as it can be sometimes, the people who work there are the backbone of that system, and really you can get your needs met. It may take a while, but if you find the right people who are working their butts off, they will jump through hoops to get you what you need, and those people are just true blessings, and they are there. So if you can find them. I hope that these tips are helpful. I hope that you are having a decent pain day, and I hope that you have a wonderful day, and I will see you guys very, very soon. Bye-bye.